Hi, I'm Dr. Ryan Cavanaugh. I'm a physical therapist at Atlas Physical Therapy in State College. Today I'm going to talk to you about TMJ, jaw, neck headache things. We get a lot of jaw patients in here, a lot of headaches, and today I'm going to talk about why a lot of that occurs and the sorts of things that we can do to help you out with that. When we look at this chart over here, this chart's showing us trigger points. Trigger points are basically spots along the muscle where the muscle belly gets injured or damaged. You can get buildup of scar tissue, kind of like micro traumas, and then a lot of times people will feel or experience that knot in their muscle, that bulge. What this chart's showing you is the different spots along the muscle belly where those spots may occur. That's where these X's are. And then all the X's are showing from there is kind of where that pain might shoot to or might refer to if it's really aggravating you. When we're talking about jaw, face, and neck specifically, there's a couple different groupings of muscles. The first grouping of muscles are, I call them your jaw muscles that help you grind up your food, basically. So you have your masseter. There's 3 trigger points on it, a lower one, an upper one, and a middle one. The masseter, a lot of times you can get tooth pain. People think that they have a toothache or a cavity or something like that going on. A lot of times that can just be caused by that muscle being aggravated. You also have temporalis. Temporalis is up on the side of your head, kind of fan shaped, and again that one can also refer some pain into your teeth. But those 2 muscles basically work together to help you grind up your food and chew everything together. They work with 3 little tiny muscles I like to call your stabilizers. Those include your lateral pterygoid, medial pterygoid, and your digastric. And these 3 are kind of around your jaw joint, and they just help to hold everything together so that your jaw doesn't experience hopefully clicking, popping, locking, things like that. So we'll talk about those a little bit more here. Lateral pterygoid can give you pain into the ear, same as medial pterygoid can shoot pain into the ear. And the lateral pterygoid can also give you pain that sometimes feels like sinus pain or sinus pressure underneath your eye. Digastric also gives you pain around the back of the ear. So a lot of times people have things that feel like earaches and problems like that because of those muscles themselves. It's not shown here, but the digastric muscle can block your eustachian tube, so that can clog up your ear. It can cause fullness, pain, ringing, all sorts of things to back up in there, and the pressure to not want to equalize. Digastric is also one of the big bridges that connects the jaw here to the back of the skull. So if this is tight and pulling on things, that's going to affect the upper neck here, or the suboccipital area we call it. As you can see with these muscles, if these get tight, people a lot of times get headaches and neck tension. So we're going to take a step back and talk about those jaw muscles again for a second. So when you eat, you chew your food, all those muscles work together, then you swallow and take a break. Take another bite, chew, swallow, take a break. And that occurs over a 20 or 30 minute meal. In comparison to that, sometimes you get people that clench, grind their teeth, people that hold their stress or their tension in their face. And a lot of times if you're doing that, you're basically holding those little muscles, these little stabilizers, tight for a very long period of time, and they don't tolerate that very well. So that's one way people can self-injure them. And again, what I talked about, getting back to digastric, so if this one is tight through here, it's going to put a lot of strain and tension on the upper back of your neck, which can give you those headaches. So that's sort of the main connector as to why people might get tension there. It can also work the other way too. Sometimes we get people with neck problems or neck pains, and that neck can tighten up this suboccipital area, bad posture, things like that, and that'll pull through the jaw, which can affect things as well. So that's basically everything involving trigger points. Now, mechanics of the jaw, if we go over here to this picture, here is the inside of your jaw joint. We blow that up on this poster a little bit. So again, you have that lateral pterygoid muscle here. It's drawn here, coming back underneath that eye bone. What that muscle does, as far as your disc is concerned, is when your mouth's closed, your disc sits a little bit in front of that bone, kind of like this, and then as you start to open your mouth, the bone comes forward and the disc slides back a little bit, they meet up, and then they go the rest of the way. Kind of happens in reverse when you close. So it's that mechanism that keeps your jaw from locking and popping and things like that with that disc. So that muscle is a lot of times responsible for that, as well as the joints. So if there's joint tightness, that can cause problems too. So basically, you see, this muscle controls a lot of issues and a lot of mechanics with your joints. So again, if that's tight, that's going to create a lot of problems. Last little point that I like to make to people is that this connective tissue kind of connects back to your eardrum. Here's your ear hole right there. So this is all sort of connected. So there's a lot of soft tissue connections in through there. So again, a lot of times we get people that have problems with their ears, with ringing, fullness, things like that. So their doctor may suspect that it is caused by a TMJ problem, and that is why. So that is basically what you can expect if you come to Atlas Physical Therapy. We're going to be looking to make sure that those sorts of things are working together, to make sure that this whole system through your jaw is doing what it's supposed to, and the muscles and joints are working together equally. If you have any questions, comments, or concerns, feel free to check out our website or shoot us an email. Thanks a lot and have a good day.